Alright, so I've already got my patient's vital signs, height, weight, BMI, and we did the Snellen's charts test. So that tested for distance vision, so that tested cranial nerve 2 and near vision. So I'm going to perform hand hygiene. I'm going to introduce myself to the patient. Hi, I'm Erica. I'll be your nurse today. And then I'm going to provide us privacy. And then I'm going to explain the process. So we're doing your head-to-toe assessment. So it is head-to-toe, so it's pretty lengthy. So if you need a break or use the bathroom anytime, just let me know. So we're going to start with a general survey and check mental status. So the patient's supposed to be sitting up on an exam table. And we're going to check the level of consciousness. So we're going to make sure they're alert and oriented times 4. We're going to check their posture and position and their body movements. Make sure they're like sitting upright and not hunched over or anything. And then we're going to make sure their facial expression and their mood and affect is appropriate for the situation. And we're going to check their hygiene, make sure it's good and appropriate. And then we're going to check their speech. So can you say a few words or sentences for me?
Hey, how are you?
I'm doing good. How about you? Okay. And so then we're going to go to the head and face. And so we're going to inspect and palpate the head for normal contour. Okay. And then we're going to inspect and palpate the hair for consistency, distribution, and color. All right. And now we're going to inspect just the face for symmetry, any skin color and features and like conditions. And then we're going to palpate the frontal and the maxillary sinuses. So just tell me if you feel any tenderness. All right. So then I'm going to palpate the TMJ. So can you clench your teeth? All right. And that tested cranial nerve 5. And so can you smile, frown, show your teeth, puff out your cheeks, raise your eyebrows, and show your eyes tight. Scoot your eyes tight. All right, and that tested cranial nerve 7. So then we're going to go to the eyes. And I'm just going to inspect the external eye and make sure they're symmetric. I'm going to look at the lids, the sclera, make sure it's white and doesn't have any yellow. I'm going to look at the cornea and the lacrimal gland. And so then I'm going to test pupillary reaction. So can you stare straight at me? Okay. And they were equal, round, and reactive. So then can you stare straight at this and follow it? All right. And then can you follow it again with just your eyes? Okay, and that tested cranial nerve 3, 4, and 6. And so then I'm going to move to the ears, and I would inspect the auricle, the tragus, and the lobule. And then I would palpate the auricle and the mastoid. So do you feel any tenderness? All right. Then I would have an otoscope, and I would just look at the external auditory canal, and I would also check the tympanic membrane, which should be pearly gray and translucent. Okay. And then I'm going to perform the whispers test. So I would stand a few feet back, and I'm going to whisper a 2-syllable word. Okay. And now I'm going to go to the nose. And I would just inspect the external nose for color, symmetric, if there was any drainage, and nasal flaring. Okay? And then I would palpate the nose. So can you just tell me if there's any tenderness? All right. And then I would, can you plug this side nose and breathe out the other one? Okay, and can you do that one? And that checked nasal patency. So then I would have the otoscope again, and I would check the inside of it, and I would be checking the mucosa, which should be dark pink and not pale, and then make sure that the septum is intact and the turbinates. All right. And then I would be going to the mouth, so I put some gloves on. So I'm going to inspect the lips, show me your teeth, and then I'll check the gums, and then the buccal mucosa. Alright? And then I'll also inspect the hard and soft palate. And then can you say ah? And that checks the uvula and it raises midline, and that checks the cranial nerve 9 and 10. And also I'm going to grade the tonsils, and they're about 2. And then I would also inspect and palpate the tongue. And then I'm going to put my hand here, and can you press against it? Okay, double shot. And that tested cranial nerve 12. And then here I would also do the gag reflex, and that tests cranial nerve 10 as well. Okay, so then I'm going to remove my gloves. And I'm going to go to the neck. So I'm going to inspect, just make sure it's midline, symmetric, and the thyroid isn't visible. And then I would palpate for the lymph nodes. So that's the preocular, postocular, occipital, tonsillar, submandibular, submental, and the cervical. Alright. So then I would inspect and osculate and palpate the carotid arteries. So I'm going to osculate. Make sure it's not down. Can you hold your breath? Okay. You let it go. Can you hold it again? Alright. And I didn't hear any bruise. And so now I'm going to palpate one at a time. Okay. So then I'm going to perform range of motion. So can you turn your head to the sides? Alright. Can you do it against resistance? Alright. Can you do your ears to your shoulders like that? Alright. And can you do it against resistance? Alright. And then last one, can you go up and then down? Alright, resistance. Alright. And so then I'm going to go to the musculoskeletal, the upper extremities. So I'm going to inspect and palpate the arms for skin color, lesions, temperature, texture, moisture, and tell me if you feel any tenderness. Okay. Alright. And now I'm going to palpate the brachial pulse, the radial pulse, and then I'm going to inspect the fingers for texture and any clubbing. Alright. So now I'm going to inspect and palpate the joints like the shoulder, elbow, and wrist. And I'm going to inspect and palpate and see if there's for symmetry, any swelling, deformities, tenderness, and crepitus. So just tell me if you feel any tenderness. And also the fingers. Alright, and now we're going to test for range of motion. So can you just go like this? Alright, and can you do it against resistance? Alright, can you take your hands? Can you do it against resistance? Alright, can you do your fingers? Can you do that resistance? Alright. Oh, and can you go like this? Like, yeah, just look at, and you do it rapidly. And that's tested for rapid altering movements. Okay, and so now I'm going to go to the posterior thorax and lungs. So can you turn around for me? Alright, and I'm going to inspect the posterior thorax and lungs for symmetry, skin color, and lesions. And I'm also going to inspect the AP to posterior diameter, make sure that it's 1 to 2, but the AP to posterior, yeah, make sure it's a 1 to 2 ratio. And then I'm also going to see if there's use of any accessory muscles. So I'm going to palpate for crepitus, tenderness, and masses. Do you feel any tenderness? And then I'm going to palpate for tactile firmitus. So can you say 99?
99.
Again.
99.
And again.
99.
All right. I would also do chest expansion. So can you breathe out real quick? Okay. And then here I would osculate for breath sounds, and it would be 18 to 20 positions. And then I would perform blunt percussion for CVA tenderness. So just tell me if you feel any tenderness. Okay. All right. And so can you turn? And I would inspect the interior thorax and lungs. And so here I would inspect the anterior thorax and see if there for symmetry, skin color, and lesions, and that if there was any use of accessory muscles. And then I would also inspect and palpate for crepitus, tenderness, masses, and tactile firmitus. So I'm going to watch the respirations and note their quality and pattern, and they're shallow and pretty regular. All right. Then I would osculate for breath sounds, and there would be 10 positions. And then I'm going to test for skin mobility and turgor. All right, and then retreating quickly. Okay, and so now I'm going to move to the precardium, but we're going to have to lay the patient down and elevate the bed 45 degrees. Okay. So here I would inspect the jugular vein and inspect, palpate, and osculate the carotid arteries one at a time. And so I'm going to inspect, palpate, and osculate the apical pulse. So can you raise the shirt up just a little bit? All right, so I'm going to inspect, and I'm going to palpate. And then I'm going to osculate. And I'm going to osculate for 60 seconds. Okay, and that was about 62 beats per minute, and they were pretty regular. Okay. So then I'm going to osculate the aortic, pulmonic, Irvis point, tricuspid, and the mitral. Alright. And I heard S1 and S2, and they were separate, and I didn't hear S3 or S4, and there was no murmurs. Okay. So now I'm going to go to the abdomen, and I'm going just to inspect it for that it's symmetric, the color, any lesions, pulsations, and the contour. And so then I'm going to osculate with my bell for bowel sounds, and I'm going to start in the right lower quadrant and go clockwise. And now I'm going to palpate, and I'm going to start lightly. Okay, and I'm going to go deep. So now I'm going to go to the musculoskeletal and the lower extremities. So I'm just going to inspect and palpate the legs for symmetric, make sure they're symmetric, skin color, temperature, moisture, texture, and hair distribution, and any tenderness. So just tell me the tenderness. Alright. And now I'm going to palpate the popliteal pulse. And then the dorsal pediis pulse, and the posterior tibial pulses. I'm also going to assess for edema, and then I'm going to inspect the nails for texture and capillary refill. Okay, and it comes back less than 2 seconds, so that's normal. Okay. Then I'm going to inspect and palpate the hips, knees, and ankles for any swelling, deformities, symmetric, and crepitus, and tenderness. So just tell me if you feel any tenderness. Okay. So then you're going to, can you set up for me? Just have your feet hanging off. And I'm going to test for the patellar and deep tendon reflexes. Okay. All right, there we go. Okay, and can you lay back down for me? Sorry for all the movement. Alright. And so we're going to test for range of motion. And so can you pull your knee to your chest? Just one leg at a time. Okay, the other one. And then can you do it against resistance? Okay. And can you sit back up for me? So, can you do your knees? The other one. Alright, and can you do it against resistance? Okay. The other. Alright, and can you bend your foot up and down? Okay, the other one. Alright, and can you do it against resistance? Like resistance. Alright. Okay, so you can sit up for me? Alright, and can you turn around? Sorry. And I'm going to inspect the spinal curvature from the back and from the side. And I'm going to inspect and palpate the vertebral process and the paravertebral. Okay. And so can you bend over like you're touching your toes? Sorry, turn around this way. And then, okay. And I'm going to see that the lumbar curvature is flattened out. I'm going to check for scoliosis. Okay, you're good. And now I'm going to observe your gait. So can you walk just a few feet with me? Okay, can you come down? Alright. And then can you do heel to toe? Okay. And you're going to perform the Romberg's test. So can you just put your feet together and just... Okay, and then we're going to do it with your... Can you close your eyes? I'm going to do it for 20 seconds. Alright, and so can you put your arms out like this and keep your eyes closed and just bring your finger to your nose one at a time. Okay, the other one. Alright, and so that concludes our head to toe assessment, and I will just let my patient know if he needs anything. He can just let me know, and I would perform hand hygiene, and I would make sure I would document all my findings, and that